sex 4 times a week, it will reduce your incidence of stroke. Please, the entire male generation is listening to.
Anyway, I mean, the truth is that, I mean, of course, sex is a form of exercise and a form of a way of helping you relax your body. The other thing is that we've also had cases where they were actually having sex and the person developed a stroke. It all boils down to the risk factors, and then it boils down to the risk factors, and then sometimes some of the sexual activities. For some people, they take in a lot of medications and aphrodisiacs just to be able to do a long duration of sex. Of course, if you want to do that, you are putting yourself at higher risk of getting some medical conditions. You could get a heart attack during the process. You could even get a stroke during the process because your BPs could go up during the process and you could get a stroke. So there's no one-way answer to that question, but the truth is that don't overdo it. Overdo it, exactly. Don't overdo it.
Don't go and kill yourself.
Otherwise, you will end
Don't go and kill yourself, please. 0541022318. So, can you tell us about this stroke thrombolysis that is happening at Konfanochi?
Okay, so the stroke thrombolysis project was an initiative that was conceived last year, and it became full-blown this year. So from January, we've really set off course, and we've had a lot of success rates where people who came in early were able to receive the thrombolysis. So the stress word is people who came in early.
People who came in early?
Yes.
Okay. How early is early, Dr. Oppong?
How early is, as I said, at most 2 hours. So I'm not saying that you come in 2 hours, within 2 hours of the onset, but even if you can come in within 30 minutes, it's better. The earlier, the better. So there's this acronym we use, be fast. So you have to be fast about it. Like, as soon as you see the symptoms, we have ambulance call lines, we have designated call line that you can call, and they'll bring you to Konfanochi. As soon as you get to Konfanochi, there's a dedicated team at the emergency that will attend to you, make sure that everything that you need to do, the investigation, the scans that you have to do, everything is put in place. And then we do the NIH score for you, and everything. If you are everything is put in place and you are ready to receive the medication, then as soon as you receive the medication, the medication, the purpose of it, so when we say thrombolysis, the medication, what the medication does is that it breaks the blood clot. So as we are saying, it's blood clot. It's not for every type of stroke. If your stroke is hemorrhagic stroke, the medication is of no benefit. It won't benefit you. So that's why you have to come in early so that we do the assessment. So during the lab assessment, we do the CT scan. When the CT scan shows, it's able to differentiate whether it's hemorrhagic or ischemic. When the CT scan is able to do that differentiation for us, we're able to, single you out that you have ischemic stroke and that you're a candidate for thrombolysis. And once you are still within the window period, once you are given a medication, the likelihood of you getting back on your feet is very high. We've had scenarios where people who were thrombolyzed, they couldn't lift up their hands. By the time they were now able to lift up their hands, people who had lost their speech now could talk. Some people think it's a magic pill or a magic potion, but it is a drug, and the medication, I've explained how it works. Once it breaks down the clot, the blood supply that initially wasn't moving to that part of your brain begins to move. And it restores you of what you were going to lose.
Okay.
So I would like to advocate that we should always come in early. The earlier, the better.
Okay. So coming in early is okay. Let me pick this call and then we continue. Hello. Good morning. Hello. Good morning. Okay. Um, we'll have to try that again. So when you have to come in early, that is within, let's say, 2 hours of you seeing that,
Of you seeing the symptoms.
of you seeing the symptoms.
Yes.
So let's say somebody has a stroke. I've seen that something is happening. If I'm coming to Confanoche, where am I coming to? Who am I coming to? What am I saying?
So
Is it on? Please. Hello. Good morning.
Good morning.
Okay. Yes. Sorry. Your name and where you're calling from, sir?
My name is Kofi Ajay. I'm calling from Amanfru.
Okay, Kofi. Kindly go ahead.
Okay. I have a problem. The problem being that my father had this attack and we brought him to Confanoche last month, 27th September. And he was diagnosed of this stroke, ischemic, acute ischemic stroke or something. And on his discharge, I asked the doctor what are his chances, and he said we brought him late. And I asked if there was a time range, and he said it's 12 hours to 24 hours. But at that time, we were at Confanoche. It happened on a Friday, and we brought him around 9 a.m. on Saturday. But still, nothing was done. We brought him to the emergency, and I stood there for about 3-4 hours, and no one came to him. I don't know why.
I see. Interesting.
How is that possible? Emergency has to be an emergency. You understand my point?
I understand you.
Yes. And now the man is discharged at home, and we've been bringing him to physio and speech therapy and something. If the harm has already been done, why do you tell us to bring him to physio, speech therapy, and other things? I don't understand.
I will attempt to get you an explanation. Thank you very much for your call. I think this is the reality of quite a number of people. I know you can't hold brief for for the system. That's what I was asking you. If, like he said, when they identified the problem, where should they send the patient to? Like, where should they just head to? Because I know the A&E has a waiting time, which is about 4 hours. Which is about 4 hours. I know it has a waiting, which is about 4 hours. But if you suspect somebody has a stroke, where should you send the person to?
So if at home they suspect someone has a stroke, they should send a person to the triage unit, and they should mention the symptoms to the triage person that they have brought the patient for this purpose. Because if the patient comes and they don't notify anybody, the patient might be there and time will be what? Moving.
Going, yeah.
Yes. And as he was saying, I think he's saying that the symptoms occurred on Friday. And then they brought him the following day 9 a.m., which is within 24 hours. But we don't want 24 hours. We are saying that it should come before 2 hours, because the drug can only be given within 4.5 hours.
Within 4.5 hours
Within
of
4.5
you noticing
hours
that the
of you
person has a
noticing.
stroke.
Yes.
Okay.
Yeah,
Okay.
so the other
Alright,
thing is that
alright.
the thrombolysis team has some of the members at the triage.
Mm-hmm.
Yes, so as soon as you notify the triage, they will start the call, and then the other team members will also be notified about the stroke. Yeah, so it's not something that will keep people waiting for a very long time before we respond. Once you notify the triage people that you brought in somebody who, I mean, has symptoms of stroke or signs of stroke, they will notify the team as soon as possible, and will arrange for things to be done for you. The other thing is that we'll also put some numbers out that you could also call whilst you are on your way to the hospital, and then they could also provide help. However, the other thing is that people should also understand that it is not all the stroke that we can, I mean, do the thrombolysis for. Because as my brother mentioned, if you have hemorrhagic, we will not be able to do it. Or if you've had stroke, I mean, an ischemic stroke within the past 3 months, and you get another one, which is still ischemic, we will not still be able to do it. So, in as much as we are advocating, it doesn't mean automatically when you bring a stroke patient, we are going to do the thrombolysis. We will have to assess and see if the benefits will outweigh the risk.
Okay.
So we assess to see if it will be good to do the procedure for you or not.
Or not. Okay. Okay. So there's an assessment before the procedure is done for the person.
Yes.
Definitely.
Okay. So I just want my listeners to understand that you will be assessed before they give you the treatment. And we'll put the numbers of the stroke thrombolysis unit out. We will put it on our Orange FM Facebook page. We will also attach it to the audio and video of this particular recording, which is going to be on YouTube. And then I will also use this as a way to also appeal. Let me pick this call now, continue my appeal. Hello, good morning. Hello, good morning. Hello. Okay, so I like I was saying, I'll use this to also appeal to our colleagues at Confanoche, especially the triage unit, to be welcoming with information. Is the person on? Hello, good morning.
Yeah, good morning.
Yes, thank you. Your name and where you're calling from, please.
Yeah, Kofi Jane again. And
Yes, Kofi, yes.
yes. My problem is, we were given a transfer letter to Confanoche.
Okay.
You see, when we brought my father, we were with this letter. When we give it to anyone, you just look at the letter and you put it down. If you ask the person a question, he will not answer. You see where I'm coming from?
Yeah.
So it's kind of pain. You see? Because you are there to help people. So if a problem is at stake, you should be able to maybe tell the person something. You attend to the person. But when the question is asked and you don't answer, how do you want the person to, believe in whatever you tell him?
Kofi,
and is there any treatment once that you know that this is ischemic stroke or something? Is there any treatment, or the physio and the ENT people can help?
Okay, all right. 0541 022318. That's the number to call. Like I was saying before he called, that we're just appealing to our colleagues that we know there's a lot of pressure at A&E. That one, no two ways about it. But once this is something new that we're starting at Confanoche, I think that we should put in a bit more effort to help someone like this, even to understand that maybe he's out of the treatment window for thrombolysis, but these are the options that are available. Like he's asking that now, okay, it's an established ischemic stroke. Is it just the physio and the speech therapy? Can we answer him? Is it just the physio and the speech therapy that he's going to do?
Yeah, so when it comes to stroke management, I mean, I've seen a lot of stroke patients, and I always tell the relatives as well as the patient that the management is quite a long-term kind of management. It's not like people get malaria, you give anti-malaria, the person gets war and it's going.
True.
When you have stroke, it takes quite some time for you to regain the function. For some people, as my brother earlier said, will regain their function entirely. For some people too, they will regain some level, and for some people they may not. The physiotherapy is one of the important modalities in treating stroke because it helps the function in terms of movement, the motor function in the patient. It helps you to recover that motor function very well.
Okay. When you say motor function, you mean movement?
Movement.
Okay.
So without a very good physiotherapy, regaining the movement back becomes difficult because these people develop contractures at the joints and it becomes difficult for them to move the joints. And we also recommend that the physiotherapy is started earlier and then you continue, because for some, I've seen people who recover after 6 months, for some people after 1 year. I mean, for quite some time, you will have to do the physiotherapy for quite a longer period. Just that you need to exercise some patience, especially with stroke patients, because it takes quite a longer period before they recover.
So the physio itself takes time.
Yes.
Sometimes over a year.
Yes.
For you to see remarkable results, isn't it?
Yes.
So I think that's like he's saying. I think it's the communication. That asking you to go for the physio is not a silver bullet. It's not like it's going to stop everything tomorrow. It's slow progress, but there's some progress. Yeah. And like he said, they've also started speech therapy. Yeah. So that one too takes time. So I think it's about explaining to the patient or the relative or the caregiver that this is slow progress and this will take some time. So maybe our colleagues, we need to look at that. But we're saying that the stroke thrombolysis, you should get to Confanoche at most within 2 hours. Yeah. What should the person notice before they say, no, this one, let me take to Confanoche?
So, just like he said, right, he mentioned some acronym, Be Fast.
Be Fast, yeah.
Right, So what the acronym stands for is that B is for balance.
Balance.
Right? Yes, So when a stroke starts, it usually starts suddenly. And then for some people, they may have difficulty in walking, right, all of a sudden. The E stands for eye, right? There could be loss of vision in either one eye or both eyes all of a sudden. And the F stands for face, right? So some people may notice weakness in their face, or their lip may be deviated, right? Or there may be some speech changes. Their speech may become slurred. And then some people may have arm and then leg weakness, so that goes for the E, right? So S is for speech, and then the T is for timing. So if you see any of these, right, all of a sudden, I mean, it could be that it's a stroke. It could be also something else. So once you see this, right, you make sure that you contact, you can call someone for help, and then they contact an emergency service, contact any of the numbers that we've given so that they will be informed exactly what steps to take. But then if there's a close by hospital, you can go there so that they see what's next to do.
Okay, but I will put the number for the stroke thrombolysis service, like I said, on the Orange FM page, and then we'll also tag it to this audio for this show, just so that you can, you can call them, okay? You can call them when there's something. And when somebody calls, what should they say? Because people will call panicking, so when they call, what should they say? Or that I have somebody who I think has a stroke, and should I bring the person to Konfanochi? They don't need a referral, do they?
No.
You don't need a referral.
No. So for this one, so the referral facilities can call. So those are the referral facilities. They can call and then bring the patient straight away, because this is an emergency situation where time is of the essence. We need it to come as early as possible. So don't delay at all. And if you're at home and you are calling the ambulance and the ambulance is not picking, you have your own private car.
Come with your
private car to the emergency unit, and you come to the triage. So should you call, what you should say is that you should talk about the symptoms, and then you add to it that you are suspecting what a stroke.
It's a stroke, yeah.
So that the team is alerted. When you come, you also say the same thing at the trial. Then a code will be run. And we the team members, we would all see what is happening, and we all come on board. Yes. So we would like to reiterate that they should always try and be there by any means possible. If other things are obscuring the coming there, they should still try and come. Even if you don't have a private car and then you get a praga to bring you, come with your praga.
The important thing is to make sure that you are in Konfanochi within 2 hours.
Yes.
Okay. All right. That's good. And is the service free?
So for
is it covered by insurance?
For the service, if you are insured, there are some of the services that insurance will cover for, and there are some that insurance doesn't cover for. So for the radiology bit and then the drug, you receiving the drug, it's not like it's cash and carry. No, you don't have to pay before you receive the service, because, as we said, time is of the essence. So we give that free will for you to come in, and then you receive the service before you pay. So for the drug bit of it, you can pay usually after 48 hours. After you have received the drug, you can mobilize money and all that, and we give you that allowance for that. For the other parts too, before you be discharged, at least you should have been able to mobilize some funds to defray that cost before you be discharged. And I think the person had another question with respect to the management. I would like to add to it that apart from the physiotherapy and then the speech therapy, the medication that we give are very, very important, because every medication and what it is doing. So some people might be on certain medications to control their heart rhythm, because it was because of the heart rhythm that they had that cardioembolic stroke. The person should stick to the medication. Some too might be on a medication to prevent clotting, because there was a clot in the blood, in the heart that led to the clot dislodging. So that medication should be adhered to. Some might be put on cholesterol medication, and they'll be asking themselves, my cholesterol is not high, why am I? But the cholesterol medication also has some benefits.
In the treatment.
In the treatment.
Okay. So whatever medication that you are given when the diagnosis is made, you're supposed to follow the medical instruction.
Yes. You have to stick to the medical instruction. And there are some drugs that are nootropics. They help to enhance the brain cell function, augment it and all that. Some examples of it, we have somazina, paracetamol, and the rest. All those drugs help you to regain the function. At least, if you're not taking it at all, it would have been slower. But if you take those medications,
it's faster.
Faster, yes.
I think sometimes the disenchantment for people is that It's like it's taking long.
It's taking long.
Yeah, like, every month we're coming to the hospital. They'll give us 4 packs of tablets. We'll go to physio, we'll go and sweat a bit. We'll go to speech therapy. Like, the speech is not coming. We see the person is struggling. So then relatives or family members and caregivers, they just give up.
Get frustrated.
Because it's like, like nothing is changing. The man couldn't walk 6 months. He's still not walking. You understand? I think that we should also manage the expectation and frustration of people.
Yes.
And usually what I tell caregivers is that you are as part of the care as the person who is ill or the person who is unwell. If you give up, they've given up. Because you are going to decide to bring them to hospital. So if you say the physio is not working, we'll stop going. The person has no option but to go with your decision. So you are taking a decision on their behalf. So as much as possible, if you're taking care of somebody who has a stroke, don't give up. But I think that the key take home is that Kwarteng now has the stroke thrombolysis service, which means that you must get to KATH emergency if you think somebody has a stroke within 2 hours. And fingers crossed, they'll get everything done for you within the 4.5 hour window to be able to start the medication for the person. Just that the caveat is that it is not for every kind of stroke. And if the person has had a stroke before, the person is not a candidate for the medication. Are children eligible for this service if the cause of the stroke is ischemic? And or that one, Kwarteng people, you don't want to stick your necks out.
I think so. Basically, most of these interventions is based on studies that have been done. And then, depending on the age categories that they use, the ACAS 3 trial that was used and the NETS trial, all of them, they did not include children in the study. So, so far, for now, we are only doing it for adults.
Okay.
Probably if later on we realize that, they will benefit or be beneficial in children from the further studies that we are doing, then we will include children. But for now, it's mainly adults that we are doing the thrombolysis for.
Okay. So for now, it's mainly adults that we're doing the thrombolysis for. Let me share this message. It's quite realistic from Ayo. So Ayo is asking me that. So for people who literally live very far away from Kwarteng, the 2 hour window will be exhausted in traffic and trying to get to KATH. Yes. If somebody is listening to us and let's say they are coming from, let's say, Edubiase, or they are coming from Manso, by the time they get to Kumasi, not 2 hours now. So.
So for the 2 hours, that's the ideal time. It doesn't mean it cannot go a little beyond the 2 hours. Because, as we said, when you come here, you have to do assessment, you have to go and image your brain to see the kind of stroke that you have. We need to do all that and still be able to give the drug or the therapy within the 4.5 hours that my brother spoke about. But it doesn't mean that maybe if you're able to report there within 3 hours, we'll not be able to do something for you. But we always say the 2 so that people will have that agency and be able to report early to the hospital. But if you're able to get there probably within 3 hours, and we'll be able to hopefully do something for you.
Okay, so someone's asking, is this service available day and night?
Yes. Yeah. It's 24 hours. It's a 24-hour service.
Okay. So, please, you heard it from them. They say it's a 24-hour service. So, Maybe they are part of the 24-hour economy. It's a 24-hour. It's a 24-hour service. So at any point in time, when you get there, you will be offered the service. So let's say if somebody is coming from, let's say where I work in, somebody's coming from Mampong, Ejura, Yeji, within transit, or when the health worker is sending the patient, is there anything they can do in between? Can you start your antihypertensives for the patient? What can you do whilst you're sending the patient? Can you give them their medication, or you just leave them like that?
So for thrombolysis, the caution is that we don't thrombolyze you when your BP is very high, about 180, 110. No, you have to first stabilize your BP before we can thrombolyze you. So if you're a health worker or you're a paramedic and you are bringing them with the ambulance and the BP is very high, you can stabilize the BP so that by the time the person comes to emergency and we are going to give a medication, the BP would have been stabilized already. It's not like we will have to now come and use the time to stabilize the BP before administering the medication.
Okay.
I would like to add that this whole project, it doesn't necessarily sort of the need for, let's say, emergency care, it doesn't take that one away. So just imagine you are living far off and it will take a lot of hours to get to Komfanoche. It's not like once the stroke happens, maybe the patient is not even stable enough for transport, and you put your relative, let's say in your private car, trying to get to Komfanoche, and you come to Komfanoche and it's even a bleed and it can't be thrombolized. Meanwhile, your relative is in a state where, not much can be done at the moment. That's why it's always necessary, especially if you live far off, go to the health care, to the health facility closer to you, because there they can have ambulance services that can use their sirens to transport you quickly, even faster. And then when you get there too, they will assess you, make sure that there isn't anything that will cause, let's say, death within a very short time.
Okay.
Yes, so that they can stabilize you enough for the transport. It doesn't take away the need for emergency services at all. So it's not like once you see that your relative have a stroke in a state where, transporting wouldn't be ideal, and then you put such a relative in the car transporting to Komfanoche. I don't think that's good enough.
Okay. Mildred wants me to find out before, because our time is almost up, before we go. Mildred wants to find out from the team. She's saying that how expensive is the thrombolysis care? How expensive is the thrombolysis care?
So for the drug bit, since I'm a pharmacist, I would like to say that the drug bit of it. So for now, the drug costs 15,335. So
is it?
Let me say roughly 15,000, or let me say 16,000, close to 16,000.
Okay.
Yes, so the drug costs close to 16,000 Ghana cedis. Yes, but if you do the cost effectiveness analysis, you realize that if you had received that, you had spent the 16,000 now, compared to you not spending the 16,000 now, and then after the stroke, the drugs you would have bought after the stroke, the medications you would have bought, because as you said, stroke is gradual, the therapy is gradual. So for people who were thrombolyzed successfully, they don't need any much medications apart from maybe the antihypertensive that they were on, or other things that we want to prevent future stroke we will give you. Unlike someone who had a full-blown stroke and we couldn't thrombolyze, and then is now going to receive other medication. When you do the cost-effective analysis, you realize that the cost of thrombolysis is lesser than you not being thrombolyzed and you receiving other medication over a space of 1 year, 2 years, and over. So we shouldn't be looking at the cost, as we said.
The immediate cost, but the benefit of it.
Sometimes you can mobilize, even you have to take a loan. Some people come and they don't have the money, but one way or the other, they still manage to pay.
Yeah, you get the money. I mean, if the patient dies, you buy an expensive coffin and an expensive funeral. So
some of them see that the patient has now revived and they're joy, then they're just going to mobilize the
yes,
the
you
funds.
mobilize the funds. You mobilize the funds, and even if you can't mobilize the funds, Confanachi is very helpful. They'll waive some of the bill.
Long-term payments.
They'll give you a payment plan, and we're bang on 10 o'clock here on Kumasi's Music Leader Orange 107.9 FM. I'll give my guests the final words, and then we'll sign out, and then we're done for the day. So I'll start with Dr. Frederick Kwarteng. Also, I like to mention all his name.
My closing word is that stroke can be prevented. I think that's why we are actually here today. And sometimes it's always better that you don't experience it at all than to get it, because you see all the these expensive drugs and then all that we are talking about, right? You may not even be in a state to receive those medications if you get a stroke. So the first thing is that some of these lifestyle changes that we talked about, you adhere to these lifestyle changes so that you don't find yourself in such a situation. But again, no matter where you get to, no matter what you experience, no matter the weakness or the stroke that you have, it's always better you get to the closest health facility for them to assess you so that you will know exactly what's best for you. There's nothing like this case, nothing can be done about it. There is always something to be done about every situation. So even if the weakness may not fully resolve, there are also treatment that is given to make sure that you don't get another stroke. So all these play a role. So so I would like to end with that adhere to these lifestyle changes. They may be small or they may be irrelevant, or you may think that these small things doesn't add up to anything. But when all these lifestyle changes add up together, it can have a very significant role in what happens to you later in life. So that's what I would like to say.
All right, Pastor, it's Pastor Doctor. Dr. Gyabaah.
Yeah, so I also want to say that there is hope for people who have stroke, and so caregivers and their relatives should actually have some patience for some of these stroke survivors. I've seen people who recover from stroke a lot, and so if the unfortunate happens and you get stroke, it doesn't mean that's the end of your life. I mean, there is much hope. People recover from stroke all the time, and with this thrombolysis thing that we are doing, the recovery is even higher if you qualify to do the thrombolysis. So people shouldn't give up when their relatives get stroke. There is hope for them. That's what I want to say.
And my good friend, Dr. Oppong.
Yeah, so I'd like to say that let's try and modify our stress so that we can save ourselves from being distressed. So the punchline is that if you are able to manage your stress, you might not even end up with most of these cardiovascular diseases that we are even talking about. So I also like to add to it that the lifestyle modifications are also very, very important. We shouldn't joke with that at all. And even if you have any of the risk factors for stroke and you still add lifestyle modifications and the dietary lifestyles to it, it will also help save your chances of developing a stroke. And the cost of thrombolysis might initially be high, but the long-term benefits far outweighs the cost.
So the long-term benefits far outweigh the costs, and I think that is a good note to close on. This morning, you've been listening to my panel, and I think if there's anything that we've learned today, is that stroke, when detected early, is preventable and reversible. and we've also walked you through the modifiable things, the things you can change about yourself, about your lifestyle, and why you should always go to the hospital, talk to a healthcare professional, talk to a doctor, talk to a pharmacist about your health and get the right kind of advice. I think that, this service that Confounder Teaching Hostel is running is a lifesaver if you get there on time. And let me put the line out. So save this number on your phone. You may not need it, but somebody may contact you for it. Okay, if you have a WhatsApp group, Telegram group, put it there. These numbers are important. So you can call the stroke thrombolysis unit at Confounder Teaching Hospital on 053 780 1678. 053 780 1678. That's the number to call the Confounder Stroke Thrombolysis Unit. As always, my name is Dr. Kwesi Jima, and this has been the Orange Health Lounge. We'll come your way next week, Saturday, with another exciting edition. Stay safe out there and enjoy your Saturday. Thank you.